Hi guys, and welcome to Bendy Pixie Flexibility. Today we're talking about more therapy than we are just general flexibility, but it is in fact still a flexibility thing. So this is going to be for people who have either endometriosis pain or pelvic floor dysfunctions from MS, like myself, things like that. So these are just some ideas. All of this should be pretty gentle. It will be uncomfortable if you need it, in the same way that like SMR is in general. So don't accept that there will be some discomfort, but it shouldn't be overtly painful or make you have a lot of intense response. If that's the case, you might need something more mild, and definitely get yourself a pelvic floor therapist. Okay, so we're going to start first with a washcloth. Okay, washcloth is good because it's very small. Take your standard washcloth and fold it in half, and then you're going to roll it. Once you've got it rolled into a little tube, you're going to set that tube onto a chair or a seat, preferably something that's not super squishy, just because you want there to be some resistance against this. And then you're going to sit down and you're going to put it just on the inside of your sit bone. And if this feels like enough stretch to the area, to that bottom of the pelvic floor, this might be enough. And you just sit there and you breathe and you breathe. And then once it starts to calm down and relax a little bit better, the intensity will go down. It'll feel less uncomfortable. And then you can do the same thing, just moving it to the other side. Again, right on the inside of where your sit bone is. And again, sitting and breathing. This can help the bottom part of the pelvic floor if that's really overly tense, from spasms or from endometriosis or from fibroids or from adhesions that can happen. So that's our start point. Typically, this is very, very, very mild. So if you do find that this does something, I definitely would make sure you go check with a pelvic floor therapist and get a little bit more insight and advice as to what's going on. So then now we're going to talk a little bit more about like specifically the bladder area, and also that more uterus and ovary area. So now we're going to take the same rolled washcloth and you're going to set it along your hip, right along that hip crease. Okay, and then you're going to lay down on the floor with the towel roll on that spot, and you're going to roll your hip toward the ground and away. If it feels okay to just sit, then you're going to try to do this little bit of a wiggle, and if that wiggle feels okay, awesome. Same thing on the other side, placing it into that hip crease, wiggling it side to side. Again, this is all extremely gentle. Shouldn't feel like a whole lot unless there's fairly significant amounts of dysfunction happening. But we always want to start with more gentle than less, rather than going full bore and having a lot of pain. So if that all feels okay, we're gonna graduate up to a proper hand towel. Same thing, taking your hand towel, folding it in half, and rolling it up. And yes, I am wearing a Grinch sweater. It is my favorite comfy sweater basically all year round, so I'm having a comfy morning, sorry. Alright, so now you've got this much larger roll. We're going to do the same thing. You're going to set it along your hip. Getting into that hip flexor area. This may be more intense. This may feel like it's hard to relax against. So if you relax your upper body and lay down, it will be less intense than if you arch your upper body
up into sort of like this low cobra position. Same thing again, if it's feeling all okay, you can kind of roll it side to side. Now, why is this helpful? Well, it's getting along right that area where there's sort of the ovaries, but also right along that sort of side, it skirts the side of the bladder. Other place that can be helpful
is to place it right at the mons. Now for any people that have more dangly equipment down there, that would be a little bit of a different scenario. You can still all do these set to the side, but this one doesn't really work, so I don't have a great solution for you on that one. But you're going to take it and you're going to set it right across the front of your mons right here. And you're going to lay on it there. And same thing, if it feels okay down, you can try it up. If that feels okay, you're going to tuck your pelvis and arch against it. Again, just getting a gentle stretch in the front. And for me, this is a pretty big one for helping when I'm having a lot of sustained tension and crampy feelings from spasms that happen in the bladder. All right. Now, if all of that went okay, and you purchase one of these 4-inch balls, Body Care makes them that you can purchase, but 4-inch anti-burst massage ball or Pilates kind of ball, but it needs to be a little one. This is more the standard Pilates ball size, and that's too big. So, little guy. You can use something smaller. Or even harder, like a tennis ball, but it'll be a lot more intense. So just, obviously we want to start with the more mild. I can't handle a tennis ball even at my best situation myself, but there are people that probably can. Okay, so we're going to do the exact same thing basically that we did with the towel roll, but now we're going to start it up at the top of our hip bone, and we're going to roll it slowly down into that hip crease, and then we're going to roll it across, and then we're going to roll it back up. Okay, so how are you going to do this? Well, you're just going to lay on it again. So you're going to take it, you're going to set it right up at that hip bone, just to the inside of the hip bone, and you're going to set down. And once this gets a little bit of relaxation, you're going to roll it down a little bit more into that crease, and then you're going to roll it further down into the crease so it sort of touches one side of the mons in the crease, potentially. If you have balls and you're doing this, obviously try to keep that all out of the way. We're doing the same thing on the other side, getting into that area up by the hip first. Once that calms down, and take your time with this. When I first started doing these, I would need to spend like 10 minutes per side sitting and breathing to get it calmed down. And then once you've got down both sides, then you're going to bring it across low. So just at that mons kind of area. And again, for the men, this one probably is not going to be so good for you. And then, so I'm finding a spot here that really needs it, so I'm just going to sit there and breathe into it. And I'm going to lessen the intensity by laying down a bit. And it's starting to relax, so I'm going to wiggle a little bit. And coming out. So, that is the suggestions that I have for pelvic floor pain and discomfort for endometriosis or from MS or really from a lot of different things. And the point of this really is just relaxing those fascial tissues and helping stretch against maybe adhesions and things and like fibroids and things like that. That there's actually quite a bit of evidence. I have some references in my book on it, but that stretching against adhesions and against fibroids can actually help to kind of slowly relax them and get them to break down. It's not necessarily going to get rid of your fibroid, but it potentially can help with some of the pain and reduce the amount of fascia connections that make up that fibroid over time. And then obviously with MS, bladder spasms, big thing. And for me, I have bladder spasms where I feel like I have to go terribly bad and they're horribly painful, but then I also have this like just dull ache all the time that develops, and doing this ball work really helps a lot with that. Anyways, I hope somebody finds this helpful. If you have any questions, feel free to reach out, and take care, and we'll see you next time.